Coming to endocrine, you know that diabetes is going to be the most important topic in any exam for that matters, especially with regards to the SGLT2 inhibitors, the GLP-1 receptor agonists, and the new one, the tirzepatide, which is very important in terms of obesity, and all those things can be asked in exam. The drug choices in diabetes, please don't forget that. Coming to the thyroid disorders, Graves' orbitopathy, as always, never ignored that topic. And diabetic ketosis and management is kind of a darling for any examiner, and they might twist the question anyway, they can ask in any way. Just be clear about it. And last year, we got a lot of questions from the MEN syndrome, that is multiple endocrine neoplasia syndromes, and from the APS as well, that is autoimmune polyendocrine syndrome, including the carne complex. Please don't forget that. So the MENS, the MEONs, and the APS, never forget. Cushing's, yes, possible. I cannot say with certainty, but yes, it is possible that you might get a couple of questions from Cushing syndrome. And don't forget the pseudo-Cushing's that can occur in stressful situations, alcohol, depression, so on. And other genetic disorders like androgen insensitivity syndrome has always been a darling for any examiner. And don't forget the Kallmann syndrome as well. And a couple of updates here and there. Tirzepatide, which is kind of making headlines after the semaglutide Ozempic saga. So it's a kind of a dual agonist, GLP-1, GIP agonist, very efficient in treating obesity and diabetes as of now. And we have another drug called as crinecerfont. So that has been approved for congenital adrenal hyperplasia, especially in the classic forms of 21-hydroxylase deficiency, which has been effective in reducing the androstenedione levels. And it also effectively reduces the amount of corticosteroids that is required for treating this disease as well. So that could be asked in exam. Don't forget these two drugs.